Hi there. I'm Jessica DeVita. I work at Chef, and I wanted to tell you a little story about a day in the life of a critical care medicine in the PICU and how we might apply some of these lessons in IT. I was a health unit coordinator, which is really like the center of the action. Very stressful, very intense, long hours, burnout. And I witnessed some of the most difficult experiences that families and children go through in this difficult environment. Right here at the center of the desk, you can see all of the action that is going on in this unit. And being at the center of that is just an incredible experience, very stressful, but very good as well. And then the one day I'll never forget, it's a thing you never ever want to hear, is code blue. Paging Dr. Blue, please come. What this means is that a child is in grave danger of and needs immediate medical attention. And so these beautiful little babies would come in with these heart valve defects, and this child came out of the OR and was very, very sick. It was one of the most difficult days of my career there. This baby came out and was on what we call ECMO, extracorporeal membrane oxygenation. It's not a good sign, and it usually means that things are really not going well with this child. And usually, slide timing is great. So out of the blue, this whole team assembles, and everybody's working very closely to take care of this patient and performing these incredible life-saving measures. Meanwhile, I'm running around trying to assemble an OR, pulling in temporary doors to protect the patient and protect the families from seeing these things. A lot of psychological harm can come from seeing some of the things we have to do in healthcare. So it's a lot of chaos. Evidence-based, of course. And at the end, unfortunately, this baby did not survive. But we do have is blameless postmortems. And I think in IT a lot we apply these concepts as well. But we really need to understand what happened and why that child was affected that way. We talk about building a high-trust culture, and this is something we definitely worked hard to do in that ICU because there's no other way to do it. We have to be able to encourage inquiry and examine failures. So how can we apply all of these learnings in IT? Perhaps the incident communication system can help. This kind of concise communication and patterns can really bring a lot of sanity and clarity. The other thing that we struggle in healthcare and also applies to IT is alert fatigue. All of these alerts going on, some studies suggest that doctors ignore 70 to 90% of these alerts because, and you know this happens in IT too. It's too many alerts sometimes. So we need to apply precise language in our communication, and I think this can really help reduce alert fatigue. Good communication and timely and giving the right information at the right time, no more, no less. So I have a question. Are all the different words that we use in IT helping us or hurting us in our communications? How many different words do we have to describe infrastructure? How do you think this helps new people coming along in your organization? So let's talk about some effective communication in physical spaces. A lot of this comes from healthcare and nursing. These are distances that people prefer in physical spaces. When you're really close to someone, and if you're taking care of them as a patient, you have to touch them. So here's the thing. Can I give you a hug? You should ask first. Jennifer talked about that. So thanks for asking first if you can give folks hugs. We need to pay attention to that as well. Is that slide going to advance? So a couple human factors to think about when you're dealing with communication and trying to understand it. There's a whole bunch of stuff happening in folks' minds. Territorial, the concepts of space. What are the relationships that people have and how do they feel about those things? So the next time you're having a crisis or an outage in your systems and your work, I just want you to think about some of the empathy and some of the kindness that you might need to apply with that interaction, those communications. And remember that it's not life and death. These things will help you build trust and empathy with your colleagues and coworkers. So be thinking about them and see if some of these patterns in medicine can apply for you in your workplace. And last you know, if we remembered every day that we could lose someone at any time, I wonder if we would treat each other a little better in IT. I know that that's the thing that I'm using daily. So I hope that's helpful to you, and thank you very much.